Good afternoon. I'm Dr. Adrienne King, and I am the Associate Vice President for Marketing and Communications here at the University of Toledo. Over the past several weeks, it's been my pleasure to serve as the facilitator for our Countdown to Launch webinars. In addition to our weekly conversations, we've talked a lot about different topics, everything from academics to dining and housing. And so if you've missed any of our Countdown to Launch webinars, you can find those on our Rocket Restart webpage. We encourage you to go back, find the topics that you've missed. There's some really valuable information for you and for your students as you're preparing for the start of classes on Monday, August 17th. It's been a really exciting week here at the University of Toledo as we've had a number of students moving on campus. I know I speak for all of us here when I say it's been a wonderful sight to see our students back out on the quad and walking around campus. It's nice to see the lively nature. We know that with the start of classes on Monday, many of you are anxious about what kind of student health resources are going to be available on campus. To that end, today we're going to be talking with two experts who can help us understand all of the resources that are available for our students. If you have questions for our panelists today, we encourage you to put them either in the YouTube comments or the Facebook comments. We'll do our best to get through as many as possible. And if we don't get to your question, be sure to check back on the Rocket Restart webpage. We'll be updating that following today's presentation. So with me this afternoon is Dr. Linda Speer. Dr. Speer is the professor and chair of the College of Medicine's Department of Family Medicine and oversees our student health services. Also joining us is Dr. Sammy Spann, who is the Associate Vice President and Dean of Students. I thank you both for taking the time to join us. Dr. Speer, can you tell us a little bit about your background and what roles you serve here at the University of Toledo?
Sure. Well, I grew up in Southeast Michigan in the Detroit area, and as a young adult, I lived for a number of years in the country of Chile, and that's where I went to medical school. And upon return to the United States, I had developed a commitment to primary care, so did my specialty training in family medicine at Oakwood Hospital in Dearborn, Michigan, which is now part of the Beaumont system. I stayed on there as faculty for 6 years and then went on to be Associate Chair for Clinical Services at the Michigan State University College of Human Medicine. In 2006, I was recruited here to the University of Toledo as the chair of the Department of Family Medicine. So yes, over the years I have played a number of roles. Right from the get-go in 2006, which was the same year where the former Medical University of Ohio and University of Toledo merged, from day one on the job I was assigned to oversee the student health services on both campuses. And over the years I've done a number of other roles. Most recently have taken a very active role in the physician assistant studies program on the health science campus, and that program is now formally integrated in the Department of Family Medicine as a division.
I can imagine as a medical professional that this pandemic has to have been incredibly challenging, both as an educator and as a doctor. We really appreciate all that you're doing to help care for our students and our patients. Dr. Spann, I think you might be one of the most recognized individuals on our campus. I understand that you have more than 20 years of higher ed experience working directly with students. Can you tell us a little bit about your responsibilities here at the University of Toledo?
Yes, thank you. My name is Dr. Sammy Spann. I'm the Associate Vice President and Dean of Students here at the University of Toledo. I've been here at the University of Toledo for 18 years. Prior to here, I was at the University of Northern Iowa in the College of Education and Florida Agricultural and Mechanical University in Tallahassee, Florida. I am responsible for a myriad of areas here. In particular, I'm over the student involvement and leadership, where we have over 400 student organizations and activities that go on throughout the university. I'm also over Greek Life. Our Greek organization is about 2,000 strong students that are getting in, building a brotherhood and sisterhood and doing a lot of community service. Also student advocacy and support, helping students get that extra little push in the things that they need. The University Counseling Center falls up under my wheelhouse. Student conduct and community standard. and the food pantry, which I will talk about as we go on today as well, but also supporting other things within the Division of Student Affairs under the great leadership of our Vice President, Dr. Philip Flap Cockrell.
Well, great. As you can tell, we've got two great senior leaders here on campus, and so I appreciate you both taking time. We're going to jump right into the questions. Dr. Speer, as part of our student safety commitment, students are expected to complete a daily self-check. What symptoms should our students be watching out for?
You know, that's a sort of an evolving question. In March, when we first were confronting this major pandemic situation, the thought was that people only needed to be watching for a fever and or cough. And we know now that this viral syndrome can take many different manifestations, and we really need to be alert for a much broader range of symptomatology. Other really common symptoms include extreme acute fatigue, headaches, nausea and vomiting, even upper respiratory symptoms that people might confuse with allergies have, at this point in our country, a significant likelihood to end up being a mild COVID infection.
Great, thank you. It's certainly something we're going to continue to have to watch, and so even as we start the semester, we'll continue to be posting updates from our experts all across campus. The University of Toledo is very proud to have several health profession colleges on our campus, and we're thankful for their expertise as they help guide us through this pandemic. So be checking back. We'll continue to be providing as much information as we have available. Dr. Spann, this is a good question. We've had this come up before. If I'm exposed but not symptomatic and I'm asked to quarantine, will this negatively impact my attendance for classes? And how is the university handling attendance policies? What should that student do?
Well, first off, no. The answer is no, it will not impact your academic journey. The faculty and staff have been working very hard to address this concern. If a student needs any support services, they can reach out to a variety of areas. But in my office, the Office of Student Advocacy and Support, their success coach and their advisors are going to work together as a team to help matriculate them through this process. The faculty is ready to work with you on helping accommodate the needs that you have, whether it is to give you extra time or your assignments at a later time. They're willing to work with you as well. So we're going to work on this journey together in this process.
Great, thank you. Now, Dr. Speer, I think what some families might not know is that we actually have health services accessible for students on both the health science campus and the main campus. So we've got a question from a parent who asks, if my child suspects that they may have been exposed to COVID-19, should they make an appointment at the health services center?
Well, they should call for an appointment, but that appointment is actually going to be conducted by telemedicine. Any student who's calling for an appointment will be screened, and if the symptoms are at all suggestive of a COVID-19 infection, we will conduct the visit by telehealth. We will have fairly broad hours for those visits, from 8 a.m. to 5 p.m. Monday through Friday to start with, and then we expect sometime in September there is going to be actually an expansion of those services to 8 a.m. to 10 p.m. 7 days a week. We will still have office hours for in-person visits for students on both campuses. They will be somewhat reduced this year on the main campus compared with prior years because we expect that the demand for them will be much lower. But there are still students who need, for example, to have their allergy injections or perhaps other kinds of immunizations or injections, physical exams for various purposes, and we will be able to conduct those visits in person as well. We do plan, however, to conduct all visits by appointment only because we want to make sure that we keep the facility uncontaminated by the COVID virus. So we're making extra efforts in that regard, and the students will be directed to make an appointment if they want to be seen.
Fantastic. Yeah, when you come onto the University of Toledo campus, either of our campuses. As a matter of fact, it's very apparent that necessary precautionary measures have been put into place, and so certainly our new normal looks a little bit different. Dr. Speer, there may be some folks who are unfamiliar with telemedicine. Can you help us understand how will that work for a student?
You know, it's basically like chatting with your friend on FaceTime. That's pretty much how it goes. Usually the student or anyone seeking medical services on telehealth will be taking that call either on their smartphone or on their computer. And it's basically just like chatting with your friends or family on FaceTime.
That's a great comparison. I haven't heard that before, but that's a great comparison. Dr. Spann, if my child is staying here on campus and they get sick and are asked to quarantine on campus, who's caring for them? Who's helping bring food to them? Who's checking in on them? Do I need to be worried that they're going to be here all alone?
That's a great question. The quick answer to that is absolutely no. You don't have to worry at all. We have a team of people who are working together. One of the things that we've been able to build throughout this pandemic is a stronger sense of community. We work very closely with our provost office, the Division of Student Affairs, our success coaches, our counselors, our deans. So we would have a network of people who will be working with you. Our student advocacy office will deliver medicine if you need to be delivered medicine. We're working with our new food service provider, Chartwells, who will be able to provide a meal that will be delivered to your student. And to make sure that they're feeling comfortable, we'll have someone checking in on them and making sure that everything is okay.
Great. Yeah, it's definitely it's a community here at the University of Toledo, and we're proud of that. All right, and the next question's a little bit complicated. Dr. Speer, I'm gonna see if you can help us understand how testing works. So in the event that a student calls into the Student Health Center, it appears that they might have symptoms that could be related to COVID-19. They're scheduled for a telemedicine visit. In the event that that physician then thinks that they are symptomatic and should be tested, how will they do that?
Yes, so that is the very important corollary to the whole process. If a student is deemed possibly to have COVID, the provider will put in an order for the test, and the student will have to call for an appointment for testing as well. The testing is also going to be conducted in the same main campus medical center building, and it will be attended to from a separate entrance by appointment. And we expect that we'll be able to get students in generally the same day, or if it's late in the day, the next morning.
Fantastic, thank you. Now I know when Dr. Postal was with us last week, he mentioned that the university was also going to be doing some randomized testing to be able to get a baseline for the COVID-19 impact here on campus. So we will be releasing a little more information about that. But what I can tell you is that it will be voluntary. It is going to be randomized, and we will be testing faculty, staff, and students. In the event that your student gets an email notifying them that they have been selected and they would like to participate, we will be doing the testing in an outdoor area of campus. So to maintain safety, it is a saliva test. They will drive through, get the test taken, and be moving along. We will do 500 of these for the first several weeks of the fall semester so that the university can get a better sense for the presence of the coronavirus, if any, on the university campus. All right, Dr. Spann, you're up. This student asks, will I be allowed to go home to recover? And if so, am I able to continue my coursework remotely?
Absolutely. Actually, we prefer if you can go home and be in the comfort of your home and things. But we do know that may not be a possibility if you're in a residential facility. We will also provide services and support for you there, but we would like for you to go home and be comfortable. As far as your accommodations, we will work very closely with the Department of Disability Services, as well as the other areas, to make sure that you get the accommodations you need to complete your course.
Great. Dr. Speer, we touched on this a little bit earlier, but we've got a student who's asking, with all the concerns about COVID-19 and all the preparations the campus has made, what happens if a student needs to seek health care for something unrelated to COVID-19? Do they still have that option here on campus? And do they need private insurance?
Yes, students certainly can seek services other than for evaluation of COVID symptoms. We've had student health services here, I think probably for a very long time, long before I came to the University of Toledo. And in-person services are available as well as telehealth. In some cases, students may prefer a telehealth visit for conditions that do not suggest a COVID infection, such as, for example, a skin rash or other things that could be properly evaluated through a telehealth visit. So we have both options available.
Great. Dr. Spann, this is a really good question. So with students moving in to the residential halls last week and this week, we've got a student who asks, if my roommate is partying or not wearing a mask, doesn't seem to be adhering to social distance standards, how will the university protect me? Who should I reach out to for help dealing with this situation?
Okay, first off, we would like to encourage you to reach out to your RA, your residential hall assistant, who will be able to help provide some guidance there. But at the bottom of every web page in the University of Toledo website is a report of concern. You can also report a concern in there as well, where we have our Office of Student Advocacy and Support. We have our Office of Student Conduct and Community Standards, who are on standby to help with that as well. So we ask that the students kind of bring it up front. Don't get involved. Don't try to be trying to take the command and give directions. But we're going to do this as a team. And all of us have to realize, as we work with the students, that all of us have to get a little bit uncomfortable by wearing face masks and doing things that we're not used to doing for the safety of everybody. And we will make sure that we help educate the population on that, but as well as support you in your concerns.
Yeah, I think you make a really good point, Dr. Spann. This really is going to take each of us. It is going to be about watching out for the greater community as well as ourselves. And so, we need to be comfortable approaching others and letting them know that it's important for their health and those around them to be adhering to the precautionary measures that we've outlined. And all of us here at the university have got to be taking care of one another. Dr. Speer, this is a great question. If I need a prescription filled, is there a pharmacy on campus?
Yes, yeah, that is a really good question. There is a pharmacy on campus, and it is located in the main campus medical center building. It is open for students as well as faculty and staff, and I understand it does a very robust business. I actually neglected to answer the second part of the prior question, so if you're okay with that, I'll
Sure.
go ahead. And that was the question about students having health insurance. It is the expectation of the University of Toledo that all students carry health insurance. It can be private insurance. Very commonly, students at the university are under their parents' insurance. In addition to that, the university has a sponsored plan that students can accept, or it's fairly common nowadays also for our students to carry Medicaid as their coverage. But the student health services visits are billed to insurance, and in the very unusual cases where there's not insurance coverage or the service that is requested is not a covered benefit, then students are asked to pay out of pocket.
Great. Yeah, the university does provide insurance options for students. So that is all that information can be found online on our website about the benefits of our student health insurance plan. So if you're looking for that or you're looking for details about coverage options, I encourage you to go to the website. Dr. Spann, I think we touched on this a little bit, but we've got a specific question from a parent with a student in the Academic Honors Village. If the HAV students are asked to quarantine, will they be moved to a different facility on campus, or can they go home?
Yeah, they could go home if they prefer, but we do have a location on campus for students who are going to be quarantined that we will be able to provide support services for in the situation that they have to be quarantined.
And we've got a good follow-up question here, Dr. Spann. If the student chooses to stay on campus during quarantine or isolation, Can a parent or family member come visit them while they're in quarantine?
We prefer not, because we want for the safety of the community and the student and also the parent that's coming to visit, we want to make sure that this person is able to go through the quarantine process. But we will work with parents individually if they need to get an inhaler or any medical need to help support them. We have someone who will be going to check on the student and following all the guidelines, but we will work with them on a case-by-case basis to help support them if they really need to see their student.
Great, thank you. We've got a question here from a student about the student safety commitment. Of course, all of our students who are going to be returning to campus must sign a student safety commitment, and this parent wants to know, what are the specifics in terms of what the student's responsibility is on campus? Dr. Spann, can you expand on that?
Yes, every student has the personal responsibility of adhering to the guidelines that are being put forward. This is a moving target for all of us, and we're working on it together as a team. Multiple meetings are being had every day to try to accommodate the need of our students in coming into this new normal. But students have a responsibility as well, and that is to adhere to these guidelines that we're creating along the way for the safety of others as well as themselves.
Great, thank you. You know, Dr. Speer, there's been a lot in the news and in the media lately that certain populations, certain demographics, individuals are less likely to contract coronavirus. And early on, there was a lot of thought process that perhaps college-age students, a younger population in general, would be less likely to contract the virus. Can you tell us a little bit about how that knowledge has shifted as we've learned more about this virus?
Yes, the more that we've learned about this virus, the more we know that it is very contagious, and at least among people age 10 and over, it's very contagious. The jury still may be a little bit out on children younger than 10 years old, but the thing that made it a little bit difficult to sort out, I think, at the beginning was that younger, healthier people are more likely to remain completely asymptomatic or to have very mild symptoms. And so the impression was that this group was not getting sick. However, their ability to transmit the virus and carry the virus is the same.
I think that's a really important point, and that's why it goes back to what Dr. Spann was saying about the community perspective of this. That's why we all wear masks on campus. As a reminder to folks who might be moving in either this week or this weekend, if you're in any academic building on campus, you are expected to be wearing a face mask. You'll notice all of us are wearing a face mask. This is both to protect you and those around you. When you're in your individual residence hall, you do not need to wear a face mask. You certainly can. But if you're in an area where you're not going to be able to social distance, inside or outside, we highly recommend that you wear a mask. But inside university buildings, it is a requirement. And you will be asked by another member of the Rocket Nation to put on a mask if we see that you aren't wearing one. Now, Dr. Spann, we know that starting college is stressful in and of itself, let alone in the midst of a global pandemic. For students and families who are anxious about sending their child away for college this fall and concerned about the sense of anxiety or angst that their child might have being on campus in this environment, what kind of resources are available in student affairs?
Well, we have quite a few resources here. We have everything from your success coach, our advocacy, as I mentioned earlier, but also the University Counseling Center. For the students, we have, if there's anxiety, or they just want to have some type of conversation. And our counseling center is available 24 hours a day, 7 days a week for our students. For our parents reach out to me, reach out to us in Division Student Affairs or other areas. We're here to help ease your anxiety as much as possible. As I said earlier, we're building a plane as we're flying it, right? And so we have to do this as a sense of community and a sense of caring and understanding. And we will do everything we can to make sure your students feel comfortable, safe, and connected.
Yeah, great. I think that's really important. We recognize that even under normal circumstances, You know, the first time you send your child off to college can be very unnerving for everyone, and a reminder that everyone here at the University of Toledo is committed to your student success. And so, you know, certainly reach out to any of us. Over the last several weeks, we've talked with everyone from the provost to the university president, the VP of Student Affairs, any one of the campus leaders that we've had on here in the last 6 weeks would be more than happy to be a contact for you if you've got questions or concerns. We're here to make sure that your student is successful, and we will do everything we can to protect your student while they're doing that. Oh, this is a good question. Dr. Spann, we've got a question from a student. What if my professor won't work with me in terms of my anxiety, or if I'm quarantined? In general, I'm nervous about the COVID-related issues. Who should I contact if I've got concerns?
Well, first, I'll be surprised if a faculty member wouldn't be willing to work with you, because the faculty member have been part of all of this development. Our faculty member have been great team players. They've been calling, they've been asking questions, they've been giving recommendations. But if by chance you come across that one faculty member, we ask that you reach out to our student advocacy office. Go to report a concern, your success coach, and what they will do, and what we're trying to do now is get it so students can, when they report their concern and they need help, is create a small team of people who will work with the student along the way. So instead of bouncing you off to the next person, we ask that you either report the concern, work with the student advocate, who probably will attach you to the advisor and the success coach, and try to give you the support and help you get through the process. And we ask for grace, not just for the faculty members, and we're asking for the students for grace. We also have to provide grace and understanding that this is new territory for all of us here again, and we need to work together to get through it.
Yeah, Dr. Spann, you mentioned the student success coaches. We talked earlier during the last month with Dr. Fisher-Kinney, and she was talking about the importance of building that relationship with your student success coach. It's really important once you arrive on campus, even before you arrive on campus, reach out, make a connection. Your student success coach is your campus cheerleader to make sure that you are successful here in your 4 years at the University of Toledo. And so making that connection, even before you have an issue or a concern, just so that you have a personal contact here. Certainly anyone in student affairs or anyone on campus would be happy to help you, but it's really helpful to know that you've got that cheerleader in your corner who can help you navigate the university process, assist you if you run into issues or challenges. They're here to help you, and so making that connection early and checking in with them often is highly recommended. Now, Dr. Speer, we talked earlier about testing, and so in the event that a student would call the Student Health Center and is advised to do a telemedicine visit, they are asked to take a COVID-19 test. What does that test look like? Where is it processed? How quickly will we get the results of that test?
Okay, so the test is taken with a swab. Excuse me. The room where it's done is actually a specially conditioned room that has negative airflow pressure, so that it helps to keep the virus from remaining circulating in the air. And it'll be either with a nasal swab or a pharyngeal swab. The test will be processed at the University of Toledo Medical Center lab, and the test results are typically available within 24 hours, at most 48, but generally within 24 hours.
Great, thank you. Yeah, I think folks, one of the reinforcements that we've had here is that in addition to the incredible academic expertise that we have in the College of Medicine, the College of Nursing, College of Pharmacy, and our College of Health and Human Services, is that the university actually has its own hospital here. And what folks might be surprised to know is that UTMC is one of only 9 state-approved testing sites in the state of Ohio. We were the first testing site in this region to be able to provide the laboratory needs to run those tests. And so we're really grateful for the expertise that we have both on the university academic side of the house as well as our hospital. And it's been great, even in a pandemic, to be working directly with both of those entities.
Could I comment further on that?
Sure.
So as it turns out, the University of Toledo Medical Center and the academic department of pathology in the university has quite a sophisticated clinical laboratory with the ability to do this kind of DNA testing that's needed to detect this virus. And as Adrian said, this testing was available fairly early on, serving basically the whole northwest area of Ohio, and it has been an important service to the community.
Yeah, we're very proud of that accomplishment, and so we're proud to be the leaders in the COVID-19 fight here within Toledo and the greater region that we serve. Dr. Spann, we've got a student who wants to know what kind of campus events can they expect to see on campus. We know there's going to be changes due to the social distancing requirements and trying to keep physical in-person event attendance low. But what types of events and or student engagement type of activities can students expect to see on campus?
Good question. First, I would like to say that some of your questions that we may not be able to fully address today will be in the chat section. We have several staff members, our student advocacy, success coaches, our Greek life, all other areas of the Division of Student Affairs are answering those questions in your chat. So if we don't answer them today, please keep an eye on the chat or email us at divisionofstudentaffairs@utoledo.edu. Now, to your question on what kind of events to expect, we're trying to, based on the guidelines that we're given from the governor, we're going to try to make as many events as possible following the guidelines. Students are able to ask to participate in different events that we have a request form that you go through our Office of Student Involvement and Leadership that will get approved. 10 students or less, there's a strong chance of getting approval. Over 10 students, there's another process to go through. We ask that you work with the Student Involvement Office to get those events on the books to try to see what we can get and make sure that we can satisfy the social distancing requirements.
Great, thank you, Dr. Spann. One of the new features that we actually haven't even had a chance to publicly announce yet, but for those of you tuning in, here's your sneak peek. The University of Toledo has actually rolled out a cool new walking tour of campus, and this includes both the main campus and the health science campus. So if over the next week, when the weather's going to be beautiful, you're looking for something to do, I encourage you to get out and get to know your new home here on campus. You will see the walking tour dots on the sidewalk in front of the buildings. You can actually scan the QR code on there with your smartphone and learn all about your campus and your new home away from home. Now, we've got a question here, and I feel like we've answered this one in every single one of our Countdown to Launch seminars, but we've got a question about why do we wear masks, why is that important, and what other precautionary measures one should take. And luckily, the University of Toledo has many infectious disease experts, but Dr. Jennifer Hanrahan can provide some great insight into that.
It turns out that one of the best things about the face masks is that they actually help prevent people who are unknowingly infected, so people who have asymptomatic infection. It prevents them from spreading their infection to other people. And that's why it's actually very important for everyone to participate in this. Not wearing a face mask has become a little bit of a political statement. Health is not politics. There's nothing political about coronavirus. Coronavirus does not recognize political ideology. I think it's important for people to realize that your actions influence other people. They influence everyone around you. When people choose not to wear face masks, it gives other people permission also not to wear the face masks.
That was great information. Yeah, we're really lucky to have Dr. Hanrahan and so many others here on campus whose academic research and background areas of expertise are in infectious disease, public health. They have been fantastic as the university has been putting together the Rocket Restart Plan. So in addition to the support we receive from local, state, and national levels, we've actually got our own experts here on campus who have been literally walking the halls of campus and helping advise us as we've made decisions about how to safely reopen campus for the fall. Now, Dr. Speer, I want to circle back around to Student Health Center because it is going to operate a little bit differently this fall.
That's correct.
Students will need to make an appointment no matter what they're coming in for. Is that correct?
That is correct, yes. We're actually going to maintain the door locked, and there will be a sign on the door that you must call for an appointment. Traditionally, we have accommodated walk-ins pretty easily, but because of the current pandemic situations, we don't believe that that's safe to do at this time. So we'll be requiring all students to call for an appointment.
Yeah, so that's very important to note because that is going to be different from our past practice. Students should call and make an appointment, and in the event that they are having symptoms that might lead one to believe that they could have contracted the virus, Dr. Speer, how will they be directed? Will they be given an appointment, or we talked a little bit about telemedicine?
Yes, they will be given an appointment, and the appointment could be either at a specific time for telemedicine or a specific time for an in-person visit. As I mentioned earlier, the in-person visits, since we expect the demand to be actually fairly low, in-person visits will be reduced hours this year from what we've had in past years. But the telehealth visit availability will be expanded. It will be from 8 to 5, Monday through Friday, and sometime in the month of September, that will expand to 8 a.m. to 10 p.m., 7 days a week. And the more robust service, the expectation will be that that will function essentially as an urgent care, and the student will be seen within 10 minutes for telemedicine rather than at a specified appointment time later in the day or the following day.
Fantastic. Dr. Spann, this is a good question. One parent has asked, what happens if my child gets sick? Will the university let me know, or does my student need to let me know? This is really important because there are federal guidelines that we have to adhere to as an institution. Can you talk to us a little bit about that?
Absolutely. We have students who get into car accidents or get sick on a regular time of the year. And we work very closely with the student to make sure we communicate with their parent or their family members. So we will work closely with the student to get that information out. But it will be in tandem with the students and also following the HIPAA, FERPA, all of the other guidelines that are there for us.
Yeah, it's really important for parents who are watching. You need to go online and look at the HIPAA and FERPA guidelines, because these are federal guidelines that the University of Toledo and all universities have to adhere to, recognizing that your student's privacy as a student, unless they give us permission to disclose information to you or someone else, we have to protect your students' private information. So it's important that you have these conversations with your student before or when they return to campus, so that everybody is on the same page and you're able to get the information that you need for them. So we've got a question here about counseling services, Dr. Spann. Mm-hmm. So we heard about student health services and that you would need to call and make an appointment. Is counseling services the same way, or can I just drop in during those hours? How does the counseling center work?
Well, you will have to set an appointment as well. The doors will be locked in the counseling center because it is attached to the medical center and the pharmacy, and you do have to make appointments to pick up your prescription or, as Dr. Speer said, have an appointment with the medical section. The counseling center is going to be available for you to use virtually, and also there will be some in-person counseling, but it will be set up in a safe environment where it is adhering to the social distancing requirements.
Great, thank you so much. Okay, so we've got a question. I think we've covered this before, but Dr. Spann, what advice do you have for students if they see someone on campus who is not wearing a mask or not adhering to the social distancing guidelines? How should they handle that situation?
Here again, we ask students not to be their own police station. We ask them that they reach out to us via the website where it's a report of concern, talk to their advisor or even a faculty member, and we will have people who will work to help ensure that those students are following the guidelines. Every student is signing a form that's stating that they are going to adhere to this. So when we approach you, we ask that you be willing to not just understand, but to act upon doing the right thing.
Great. And Dr. Spann, going back to the counseling center question, can you talk to us? We actually recently added and expanded our counseling services to include the health science campus. Is that correct?
Absolutely. We have counselors available for you on both main and health science campus. that will be available 24 hours a day, 7 days a week. Now, we do have our main counselors who are hired that will be available until 5 o'clock every day. After that, we have a third party that will be going on called Protocol, that students will be able to get the services that they need as well to continue the wraparound 24-hour services.
We've got some follow-up questions here about the randomized testing that the university will be conducting the first several weeks of the semester. For clarification, the goal will be to issue 500 tests a week for the first several weeks to help us get a baseline for if the coronavirus exists on campus, and if so, and to what extent. So yeah, that's 500 per week, not 500 in total. So we've got another question here, Dr. Speer, about the COVID testing. Is the COVID test free, or will my parents' insurance be billed for that?
The random testing is a separate issue, but I am assuming that this question is related to tests that are ordered related to medical services. Yes, the medical services, including any kind of diagnostic testing, are billed to insurance.
We also have some questions here from parents about student health insurance and how that works. So yes, the University of Toledo is an opt-out model. We require that all students have health insurance to attend, and so, you know, as students register for classes, they are automatically given health insurance, and if a student does not need health insurance, they either have their own private insurance or are on their parents' insurance plan. They need to provide that information to the university, and then we will remove the student health insurance. Okay, we've got some follow-up questions, Dr. Speer, here about the symptoms of COVID-19 and what symptoms students should be looking for. And I know that there's often confusion between cold, flu, even allergies. How can a student tell if it's something that they should be really concerned about?
You know, that's a question that I don't think that there's a 100% accurate answer on. But as we've had more experience over these last months with this virus, we know that the symptoms can be very mild and very easily confused with many other kinds of syndromes, including gastroenteritis, which some people call the stomach flu. It can be headaches, dizziness. It can be upper respiratory symptoms. One of the things that's pretty specific to this virus is a loss of the sense of smell, which affects taste as well. So in this day and age, anybody who has a sudden loss of their sense of smell, you should consider that to be a COVID virus infection until proven otherwise. It's so highly specific for the infection, yet it's not a really common symptom. The majority of folks don't present that symptom. So it's really an infection that has turned out to be very, very tricky, both in terms of how easily it's spread by asymptomatic people and the really varied presentations it can take. Probably some people have heard that among fairly young adults, one of the presentations is actually stroke. Central nervous system symptoms can be the predominant, and it can be quite serious. So at this point, it's really difficult to say, you know, if you've got a sniffle today that you might not otherwise think much of, it could possibly be the COVID virus.
Yeah, I think that's really important. So we've got to be watching carefully. That's why, as part of the students' safety commitment form that they sign, we are asking all students, in fact, all members of the University of Toledo community, faculty, staff, and students are all expected to do a daily health self-check. One of the resources that is available for students and others, it's a free resource. There is a mobile app that students can download called Campus Clear. They can select the University of Toledo and set a time so that every morning it gives them a checklist of things that they should be checking, including their temperature and other symptoms that they should watch out for. They can go through that checklist on their phone before they go out on campus and are interacting with others. So that's a great resource. The university is putting out more information. Parents, if you saw the letter from Dr. Flapp on Monday, you saw where we included information about some important mobile apps students should download. I would put that one on the list. And the app is called Campus Clear. It's a free mobile app for their phone. Make sure that they downloaded it. It's a great way to go through the health checklist. We've got another question here about the counseling center, Dr. Spann. So, question about, is there a limit to how many times a student can make an appointment for the counseling center?
Thank you. As we're going through this pandemic right now, I would say no, there's not a limit. We're going to make sure that the student who needs this resource is going to obtain this resource if we have to extend and bring in more support for our counseling center. So at this moment, no, there's not a limit.
Great. Yeah, we're here to make sure that you are successful, and so we'll help you and support you in any way that is needed. Dr. Speer, we've got some questions. I want to clear up a question about the testing and the lab where it's processed. So, yes, our pathology lab is actually located at UTMC, which is the university's hospital on the health science campus. But if a student is asked to get a COVID test, they've gone through the appropriate protocol, done the telemedicine visit, and a test is ordered, they'll actually be able to get that test here on the main campus, correct?
That's correct. As I mentioned earlier, we have prepared a special room within the main campus medical center with a separate entrance that will be attended to by appointment to do the testing specifically.
We've got a question on here about when will the university start planning for the spring semester? And boy, we have been planning for the fall semester for several months now, so it's hard to even imagine spring when we haven't even started fall yet. You may recall that we actually changed the dates for the fall semester under the advice and guidance of our public health and infectious disease experts, and so we moved the fall semester up 1 week. And so when students go home at Thanksgiving, they will finish their finals the following week remotely. And that was intentional so that we didn't have students and faculty and staff who would go away for a week, visit with others, and then come back to campus and be interacting with one another. So at this time, we have not started the plans for the spring semester, but we will be soon, and I assure you that you will continue to see updates on our website about what the spring semester looks like, as well as what winter intercession classes look like. It's hard to imagine planning for winter intercession in spring when it's August, but it will be here before we know it. All right, we've got another question here, Dr. Dr. Spann, I apologize. This student wants to know, I'm struggling in my classes, and I'm anxious about COVID-19. Where do I go if I just need to talk to somebody?
Thank you. Well, as I stated earlier, if you want to seek to talk to a counselor in our counseling center, you can definitely come to us. You can even reach out to me, the Dean of Students, and I will help get you there. Our student advocacy and support and success coaches will help guide you. I hope I'm giving you a theme here, is that we have a group of people who are continuously going to walk through this process. It's okay to be anxious. It's okay to be nervous. We're nervous. But as we go through this process, we're going to go through it together. We're going to take a deep breath together, and we're going to work through this. So if you need help, please don't be afraid to reach out to any of us, your success coach, the student advocacy and support, your advisor, the Dean of Students. I promise you we will make sure that this is the best experience given the circumstances.
Great, thank you. We've got a question here, Dr. Speer, this one is definitely in your wheelhouse. We've got a question from a parent about how accurate are the COVID tests that we're running through UTMC, and what is the likelihood that there could be false positive or false negative in that situation? Okay,
so the DNA test that the university laboratory is running is very, very specific. It's essentially impossible that you could have a false positive test. The rate of false negative we also believe to be quite high, but it is somewhat dependent on the technique of the sampling and also the stage of the disease in a person. If the amount of virus that is being shed at that moment is not very high, then the test can be false negative. We don't know very, very specifically for our particular lab what that average rate of false negative is, but nationally the suggestion is these kinds of labs that the false negative rate can be up to 30%.
Yeah, so it's going to be really important as you're going through this process that you continue to keep in contact with the student health services if you suspect that you may have been exposed. And so whether you're symptomatic or not, that you're reaching out if you have been in contact or been told that you have come into contact with someone who has contracted the virus. Here's a great question for you, Dr. Speer. We know there's no vaccine or medicine to treat COVID-19. But are there things that we can do to either keep us healthy or to better help us recover in the event that we contract the virus?
Well, actually, there are now some medications that are being used mainly in hospitalized patients, and people who have milder disease are really not being offered those medications. Remdesivir is probably the one, and as well as corticosteroids, that you may have heard about in the news. In general, though, people who have mild enough cases that they're able to simply recover on their own, the thing to do basically is to treat it symptomatically with fluids, some Tylenol, and rest, a lot of rest. And from folks that I've treated so far with this disease, the rest part's kind of the virus dictates that, because the intense fatigue, basically people often say, I couldn't get out of bed for days because I was just that sick. You know, it's true that we don't have a curative treatment, but you know, we hope that that is going to be in the works. There are many drugs that are currently being tested.
Yeah, this is certainly an evolving situation. We've got just a few minutes left, so I'm going to ask you both my favorite question to end with. We know that we're facing a lot of unknowns with the coronavirus. What advice do you have for our students, both to help keep them healthy, be successful in their classes, make sure that they're not overly anxious? What's the one piece of advice that you would want to share with our students in this situation? Dr. Spann, would you like to go first?
Yes. I'll tell them to keep living, keep having hope, keep being inspired, keep looking at the different changes that are going on. Circle yourself around people who are trying to accomplish some of the similar goals that you are trying to accomplish. Lastly, it's okay to be nervous, anxious, all those other things that we just talked about. Speak up. Have an opportunity where you have a platform where you can talk about what you're feeling. Allow us to let you know the things that we're going through as faculty and staff at the university. Chances are we're just as anxious. And lastly, let's do it together. Let's do it with pride, and let's do it in a way where we can get back to some normalcy here at the University of Toledo and in the nation.
I love the rocket pride there, Dr. Spann. Dr. Speer, what advice would you share with students and their families?
Well, of course, I have to reiterate first, in order to stay physically safe and to protect those that you're with, the masking, social distancing, at least 6 feet whenever possible, and frequent hand washing are the crux of it. And in addition, I would have to say that despite the fact that we're in this time that we have to be socially distant physically, that doesn't mean that we need to be socially distant emotionally. And for our health as people, maintaining our social connections and our sense of identity with community are really essential. What I've been seeing as I tend to my patients in my practice is that too many people are starved socially right now, and that is a disease in and of itself. Yeah.
Sounds like a really good excuse to call home. So, on that note, we're going to wrap up the final countdown to launch because we are just days away from the start of the fall semester. We know students, many of you are still moving in and will be over the next several days. Know that our campus is here to welcome you and help you in any way that we can. For the parents tuning in, we know that you're anxious. We will continue to provide updates on the website throughout the semester and advice for our students. If you have questions or concerns, please don't hesitate to reach out to any of the campus leaders that have joined us over the last several weeks. It's been my honor to moderate these discussions and be able to have an open conversation about your concerns and how we can be here to help you. And so we want to continue to do that. And with that, I say to our students, I hope you have a fantastic fall semester.